Welcome to KidzDocTalk with Dr. Jenny. Today's guest is Dr. Rita Patel from Sunkidz Pediatric Dentistry, talking all things teeth. Today on KidzDocTalk.
Welcome to KidzDocTalk with Dr. Jenny. Dr. Jenny is a Board Certified Pediatrician and is the Director of Telemedicine at Pediatric Associates.
Dr. Rita Patel is a board-certified pediatric dentist focusing on providing specialized dental care for children with a caring and gentle approach. Her private office, Sunkidz Pediatric Dentistry, is located in North Miami, Florida. Born and raised in England, Dr. Patel received her bachelor's in neuroscience before moving to Florida to complete her master's degree in developmental biology. She then earned her dental training at Nova Southeastern University and completed a 2-year postgraduate program specializing in pediatric dentistry. In her spare time, she enjoys spending time with her son, husband, and friends, relaxing on the beach, cooking, and reading. Welcome, Dr. Patel. Hi, Dr. Patel. Thank you so much. Welcome to the podcast. Excited to have you.
Hi, thank you so much for having me.
So before we start, tell us a little bit, give us some background of who you are and tell us just like a one-liner about your practice.
Okay, so I was born and raised in England. I moved to Miami about 20 years ago, completed my dental training at Nova Southeastern University and completed my residency also at Nova Southeastern University and opened my own practice up about 5 years ago. And we have a wonderful practice, a wonderful team. We've built a great following in the community. And absolutely love being a boss, team leader, and having a thriving business.
Fantastic. That is so impressive. So I'm excited to chat with you today. I want to start a little bit by talking about the dental home. So we talk a lot about the medical home in pediatrics and like having a place that your pediatrician is and everybody kind of helps coordinate your care. I don't hear as much about the dental home. So tell us about that and why is it important?
Okay, so a dental home is just a term that we use to describe the relationship between the dentist and the patient. And just as it's important to see a pediatrician early on, it's also really important to see a pediatric dentist early on. So we like to have patients come to see us when they turn 1. The American Academy of Pediatric Dentistry recommends that patients come to see a pediatric dentist by either the eruption of the first tooth, which is approximately 6 months, 6 months after that, or latest up until age 1.
Fantastic. Thank you. I was actually going to ask when we need to start thinking about sending to a pediatric dentist. So do you find that you're usually seeing kids of between 6 months and a year, or are they typically coming to you when it's almost too late?
Yeah, so I'm finding a good mix, but I am typically finding patients that have missed their the opportunity to come earlier. So they're coming usually around 3, 4, 5, or they're coming to see me when they're already having pain. Which is a motivator for parents to, finally bring their child into the dentist, but then it's too late. So we really want the patients to come at 1 so that we can give them all of the advice and we can give them all the techniques, arm them with the tools that they need to prevent their child from getting cavities.
Makes sense. Okay. So really important to kind of start thinking about that early. A lot of families will tell me that when I try to refer to a pediatric dentist, that they're just planning on taking their child to like the family dentist or like where the adults go. So what's the issue with that? And what's really the advantage of going to a pediatric trained dentist?
Sure. So that's a good question. There's a convenience in taking the whole family to a dentist, just to one dentist, at a family dentist. And so there typically isn't a problem with that, but they aren't trained with the additional 2 years of pediatric dental training that we are. And so with that being said, my office and most pediatric dental offices are equipped with the tools that we need to see little kids. Little kids have little mouths, and so we need little everything. So that means X-rays are the number one important thing that we have that most general dentists don't have. So we have very small sensors that fit into a child's mouth. And so we're able to take X-rays at an appropriate time when general dentists may not take those X-rays because they have bigger sensors. They're not the most comfortable to take. regardless of age. And so we try to make it more comfortable with having the small sensors in our office. And so it's important for children to see a pediatric dentist for so many reasons. I mean, we do this all day long. We see kids all day long. We know what language to use with them. We know how to treat them. We know how to talk with them. We know how to convince them to do certain things that maybe a general dentist wouldn't be able to do. We also know what to look out for as far as cavities in children's teeth. We've seen this a million times. So we know the telltale signs for children. We also know when to treat cavities on children's teeth. A lot of times cavities go untreated because there's this misconception that they're just baby teeth, so they're going to fall out, and that's true. But if you find a cavity on a 2-year-old, let's say, that tooth isn't going to fall out until they're around 11, 12. So you can't let a cavity sit for 10 years and eventually the child will have pain. So there's a lot of benefits to taking a child to a pediatric dentist versus a general dentist.
Thank you. That sounds really important. I think a lot of people maybe don't realize that you guys have all that additional training and are able to deal with like the nuances of bringing a child to a dentist, which I think probably for the first time at the very least may cause a little bit of anxiety. So definitely sounds like that's the appropriate place. So let's talk a little bit about like early intervention, because I'm a big fan of, staying on top of things and really doing good preventive health, both general health and oral health. So what can parents do and what can we as pediatricians do to encourage early oral health, like good choices for oral health?
So I guess the number one thing that as pediatricians that you can do is to refer patients early as possible to a pediatric dentist. Once a patient comes into our office, their first visit, we do a clinical examination on the child. And then most of the visit is focused on giving the parent advice. So we go over oral hygiene counseling. We go over appropriate feeding practices, such as bottle feeding, when to use the bottle, not to use the bottle at nighttime, not to put your child to bed with a bottle. Also breastfeeding and how to make sure that you're keeping your child's teeth clean, even if you are breastfeeding at nighttime. We go over counseling for non-nutritive oral habits, such as finger sucking, pacifier use. So coming early as possible is going to be the number one reason on how to prevent getting cavities and maintaining good oral habits, and also making sure that the patient is coming every 6 months to their visit. So that way we're not going too far in between visits, so that if a cavity is developing or if there's an issue developing, we can find it early.
And that's really important. I have to be honest, as a pediatrician, I feel like I'm so good at this. Like I make sure my patients are following up. As a parent, probably not so much. So definitely a good reminder for me of the importance of regular follow-up to make sure we're staying on top of that oral health. So talking about kind of the guidance that you guys provide, obviously toothbrushing, we know is super important, brushing and flossing. I've read some mixed reviews on this. So tell me what the actual source of truth is in terms of kid toothpaste and like kid mouthwash. Is it necessary? Is it just a marketing gimmick, or is there something specific in those toothpastes that we actually need to be buying for our kids?
So kids toothpaste and adult toothpaste are essentially the same. There's the same percentage of sodium fluoride in each one of those, in each child's and adult toothpaste. The only difference really is the taste. So I'm a big fan of fluoride, and so I think it's really important that children use fluoride toothpaste. Using a kid-friendly toothpaste is just going to allow the child to use the toothpaste without giving you too much of a fuss. If you try to use a mint toothpaste, which is made for adults, the child is not going to use it. And so it's important because of the fluoride that you're using that's going to be beneficial to the teeth. How much toothpaste you use is the next thing that we should talk about. Depending on whether the child is able to spit out the toothpaste. If a child's able to spit out the toothpaste, then you want to use a pea-sized amount. If a child is still swallowing their toothpaste, you want to use a smear, which it looks like a grain of rice. So that's the amount that you want to kind of just eyeball when you're putting it on the toothbrush. As far as mouthwash, again, the same concept applies. It's only if a child is able to spit out should you use the mouthwash. As far as whether the mouthwash is important, in my opinion, brushing with with fluoride toothpaste, and flossing should be sufficient. I think the mouthwash is just something in addition that you can use, but not necessary.
Okay. So you mentioned fluoride, that it's in toothpaste and you feel like it's necessary. Tell us a little more about that. What is fluoride and what are the benefits of it?
Okay, so fluoride is actually a naturally occurring element, and you'll find it in soil, water, food, and it has been added to the water as it's been shown to be clinically effective on reducing the incidence of cavities. What it does to teeth is it actually protects the teeth from decay by strengthening the outer layer of the enamel. So it makes it more resistant to getting cavities. It also will help to fight off those carriogenic bacteria that are found in the mouth. So it also reduces the ability for them to replicate. And it also reduces every time you put food into your mouth, there is an imbalance in the pH of your mouth. And so it allows for that imbalance to remain more of a balanced. And so it will not allow your tooth to get cavities.
Okay, so pretty important, and sounds like it's a benefit to having it in toothpaste. So good to hear that that's where it's typically found. So we talked about kind of oral health and like preventative things like brushing, going to the dentist, things like that. So now let's talk about some pathology, things that you guys see pretty frequently. And the first thing that came to mind was cavities. So tell us kind of, so I was reading about caps and like caps on baby teeth, and this was like a whole new world for me, which I had never heard of. So tell me about that. I didn't realize that you guys did any kind of, fillings or caps or anything on baby teeth.
Yeah, so if a child has a cavity on a tooth, then it's an active ongoing disease. And so in order to stop that ongoing disease, we have to clean out the cavity. And now you have, instead of having a cavity that is full of bacteria, now you have a clean hole in the tooth. So we can't just leave a hole in the tooth. We have to fill it somehow. So let's just say you have a small cavity in the tooth. We clean it out and we put a little filling. Okay. But if a patient comes and they have a large cavity in their tooth, you can't put a filling in the tooth. It's not going to be strong enough. And we really only put caps mostly in the back, in their molars. When a child has a big cavity, you have to clean out that cavity. You're often left with a large hole. So a crown covers the entire surface of the tooth, and it strengthens the tooth, and it keeps that tooth healthy until the new tooth erupts and allows the tooth to fall out.
Okay. Wow, that's so interesting. Again, I hadn't heard of that before. So I was really fascinated by this. And, last time I was at the dentist with my kids, the dentist offered sealing for teeth. And, my kids didn't have any cavities, so I didn't really know anything about this. I declined. But then looking back on it, I feel like I probably should have done some more research. So tell me a little bit more, because I want to be more empowered about what this offer is for sealing and whether or not it's necessary for kids who seemingly have healthy teeth.
Yeah, so sealants are a really good option for children that have their permanent first molars in. So typically we'll put those sealants on children 6 and above. And what sealants do is it protects the grooves, the biting surfaces of your molars. So if you look at a molar, there's a lot of grooves in that tooth. And those grooves are pits and fissures that will retain bacteria, retain plaque, food particles, and allow bacteria to just breed in those grooves and allow a cavity to start from the top down towards the nerve. And so what a sealant does is it protects the healthy tooth from preventing it from getting a cavity in the first place. So how a sealant is placed is that we will wash the tooth with dental soap, which is called Etch, and we clean out the grooves with that soap, and then we dry the tooth really good, and then we flow a little liquid into the groove, and we kind of spread it around with a little brush, and we set it with a light, and that hardens that liquid. So now you have a protective coating over the groove that when the child does eat, the food kind of will sit on top of the sealant and not in the grooves, and you won't be able to get any bacteria, you won't be able to get any food in that groove. So it helps to protect the tooth from getting cavities.
Does that ever wear off? Do you need to keep repeating it, or is it like a permanent seal on top of the tooth?
I wish it was permanent, but it's not. So and this is why it's important to not skip your visit. So every time you go to the dentist after we replace the sealant, we make sure the sealant is on there properly. And if it has fractured off, we can easily just replace the sealant. So if you get a good 3 to 4 years out of a sealant, you did good.
Okay. Wow, fantastic. All right, good to know. I feel more empowered next time. Next time I show up and they offer that, sounds like I absolutely should say yes. So what I'm just curious, what is the typical age that you start seeing cavities? I don't know if that even age exists, because I'm sure it varies on when kids are coming to you, but what's kind of like the age when we should start thinking that like, hey, this may be an issue for my child?
Okay, so I have seen it all. I have seen babies as young as I hate to say, as young as 12 months have cavities.
Wow.
Yeah, and so typically those children are, maybe the teeth came in early. So the earlier your teeth come in, the more they are exposed to bacteria and food source. And so a lot of times those children are either being bottle fed and they're going to bed with a bottle of milk or juice. And so their teeth are constantly being bathed in sugar. Or it's sometimes I see it a lot with breastfeeding moms. And so I will see cavities on younger children because of those two things. But I have seen 1-year-olds that have cavities.
Wow, that is very impressive. I think every pediatrician listening now, I think cringed a little when you said bottles of juice. That's like our worst nightmare. But certainly good to know that it's not just the juice, right? It's milk. It's even breastfeeding, right? Can be a risk because there's sugar in that milk.
Breastfeeding, yes. And unfortunately, I've had to I think my youngest patient was 1.5 years where I had to take out all 4 front teeth because there were cavities into the nerve and the child had dental abscesses.
Wow. That is very impressive. So it reinforces the idea of sending to you guys early. Absolutely.
Very early. Yes.
Wow. Okay. Good to know. So you mentioned X-rays a little bit. I think that tends to be like a cause of anxiety, and definitely was for me as a parent when I was bringing my child to the dentist for the first time. And like, again, just expecting a checkup, didn't think anything was wrong. And right away they said that X-rays would be needed. So what is the benefit and how often should they be done? And tell us, potential risk. Obviously we're all, you hear X-rays, so you think radiation, and something that typically it's definitely in pediatrics we try to avoid.
Sure. So X-rays are really important because without X-rays, there are certain areas in the mouth that we just can't see clinically. So obviously, if a child is coming in and it's their first visit and they are, let's say they're a 1-year-old and they don't even have all their teeth in yet, and they've got nice spacing between their teeth, then there's no need for any X-rays. So as the child develops, they get more teeth, the teeth migrate towards each other, and that no longer can you see in between the teeth. And so the only way to visualize those areas is by taking X-rays. And it's important because although the mouth may look completely healthy, and I've seen this 1,000 times, when we finally take the X-rays, you can see cavities in between the teeth. So the reason you come to a dentist is so that we can let you know if there's something wrong. We don't want you to come to the dentist when you have holes all over your, holes in all of your teeth. So we take the X-rays so that we can find the cavities, if you have any, that are really small. And there's so many different options for us to treat those cavities without conventional fillings if we find them very small. We can give parents advice on increasing their flossing, because that's the way you can prevent cavities from between your teeth is by flossing. And those are the only way, and X-rays are the only way to detect them when they are already small. So we take the X-rays only when the contacts are closed. And if we don't find any issues, we'll take X-rays every year. If we do find some areas of concern, we will take the X-rays every 6 months so that we can monitor those areas of concern. Or if your child does have X-rays and we find cavities that need to be treated and they are treated, we need to make sure that those fillings stay healthy and that the child doesn't get cavities again underneath those fillings. So it's important at that point to take X-rays every 6 months.
Okay. All right. Good to know. So I think super, super important for us to keep that in mind, especially knowing that you don't necessarily have the ability to visualize exactly. all cavities, right? Like I think people probably just assume, can't they just look in my mouth and tell? But you're right? Teeth are close together.
Yeah, you're absolutely right. I mean, you can't see, most of the cavities you cannot see with your eyes. But I have diagnosed a completely healthy looking mouth from the outside with 8 cavities after we've taken the X-rays.
Okay, super critical. So another thing that I'll sometimes send patients to the dentist for, or I've taken my own kids to the dentist for, is teeth grinding, right? Kids who grind their teeth either during the day or at night when they're sleeping. And my dentist kind of reassured me, but I was unclear as to why this happens and like what I should watch out for in terms of it getting worse.
So interesting. I would say about 70% of the parents that come to my office with their child will ask me about the grinding. And there has not been a definitive reason why children grind. There's nothing definitive like this is why your child is grinding. When babies grind, I think it's because their teeth are new and they're just trying to establish their bite. And so they will typically just kind of grind their teeth together. It's usually nighttime grinding that parents will complain about, not usually daytime grinding. And so, again, there's not really any good, clear reason why a child grinds, but typically those children that grind have a slightly higher anxiety level and stress level. But the good news is that this usually decreases as the child gets older and develops more permanent dentition. The teeth grinding usually decreases. And I haven't seen too much of an issue as far as, so if you do grind your teeth and you do grind the enamel away a little bit on the primary teeth, I don't really have too many issues as far as sensitivity or an increased incidence of getting cavities on those teeth. So it's typically not a problem as long as your child is not complaining of any sensitivity. Now, as the child gets older and they're grinding and now you're in more permanent dentition, then obviously we don't want to wear down the enamel on the permanent teeth. So at that point, we may refer to an orthodontist to create a night guard. But for young children with night guards isn't really a good combination because they're just not going to wear it. And so, yeah, it's typically not a problem.
Okay, fantastic. So we covered a lot of ground. We talked about preventive health and oral hygiene, cavities, and right, the importance of frequent checkups and X-rays. Talked about teeth grinding. What else? What else do you want to make sure that we know as parents, as pediatricians? What should we be making sure that we are doing correctly with our kids and their little mouths?
I think the most important thing that we as parents can make sure we're doing for our kids is ensuring good oral healthy habits at home, right? So making sure that you are keeping on top of your kid, making sure that they're brushing in the morning, brushing at nighttime, not snacking or eating, drinking after they've brushed their teeth, making sure that you're setting those expectations from an early age to make your life easier, right? So you'll do it morning and night. If you have a fussy child, doing the best you can with your child, but making sure that you're not giving up and you're consistent with your brushing morning and night, adding the flossing when you see that the teeth are contacting each other, and limiting the amount of beverages, sweetened beverages during the day is something that can also benefit the teeth. So 1 juice box a day, not too much snacking on chips, cookies, crackers, because that also is feeding the bacteria in your mouth that allow for cavities, and just picking good, healthy snacks as opposed to chips, cookies, unhealthy snacks.
Fantastic. That is really practical advice. We actually talked at one of our last episodes about picky eating and like making good choices. So I think we're definitely on the same page. In fact, we as pediatricians say no, 0 juice. That's like officially, right, the recommendation.
Me too. I like that too. But if you're going from a child that's been drinking 6 or 7 and you hear 0, I'm the bad guy. For sure. Yes, I can sympathize with that. Okay, well, listen, thank you so much. I do have one last question. It's the hardest one, so I saved it for last. What is the going rate for a tooth right now with the tooth fairy? We get asked this a lot. Oh boy. Okay. Well, I've seen it all. I think the most expensive tooth cost a parent, I think it was $20. Wow. Wow, okay. But I do not tell any of my kids that they're getting $20. Okay. I was gonna say that tooth fairy has a fantastic gig. Exactly. Wonderful. Well, listen, thank you so much. This was really, really informative. I learned so much. Thank you for the practical advice. And if anybody wants to find you on social media, where can they find you? We have an Instagram page, a Facebook page. It's at Sunkidz Dental, Sunkidz Dental. And we are located in North Miami, Florida.
Very good. We'll include all of that in a description for the podcast. Thank you so much again. Thanks for joining.
Thank you so much. It was wonderful. Thank you.